Do you know what acute appendicitis is? It's a condition characterized by the inflammation of the appendix, a small finger-shaped pouch that projects from our large intestine on the lower right side of the abdomen. This isn't a minor issue. It's a medical emergency that often necessitates immediate surgery. Ignoring it can lead to complications, such as a ruptured appendix spilling infectious materials into the abdominal cavity. So, acute appendicitis is not something to take lightly. Now, you might be wondering how acute appendicitis happens and what symptoms it brings. Acute appendicitis typically takes place when there's a blockage in the lining of the appendix. This obstruction can be due to various reasons like an accumulation of fecal matter, inflammation, or even a foreign object. Once blocked, the appendix becomes inflamed and filled with pus, causing significant discomfort. Now, let's talk symptoms. The most common one is a sudden sharp pain that starts around the navel and then shifts to the right lower abdomen. Other symptoms include a loss of appetite, nausea, and vomiting. Some people even experience a low-grade fever. It's crucial to recognize these symptoms early to prevent complications. Scene script. How do doctors diagnose and manage acute appendicitis? Well, it often starts with symptoms and a physical examination. Doctors listen carefully to your medical history and perform a thorough physical checkup. They look for classic signs like pain in the lower right abdomen, but sometimes symptoms aren't so clear-cut. That's when lab tests and imaging studies come into play. Blood tests can check for signs of infection, while imaging tests like ultrasound or CT scans provide a clearer image of the appendix to confirm the diagnosis. The immediate management of acute appendicitis often includes antibiotics to tackle the infection and pain relief to ease discomfort. But in many cases, surgery is the most effective treatment. What does surgery for acute appendicitis involve and how is the recovery? Well, the common solution is a surgical procedure known as an appendectomy, where the inflamed appendix is removed. This can be done in two ways. The first is open surgery, where a single large incision is made. The second is a less invasive method known as laparoscopic surgery, where several small incisions are made and a camera guides the surgeon. After the surgery, the recovery process begins. Patients typically stay in the hospital for a couple of days for monitoring. Pain management is an essential part of recovery, and this is usually managed with medication. Gradually, patients are encouraged to move and walk around to promote healing. Over time, they can return to their regular activities, but this varies from person to person. Keep in mind, everyone's recovery journey is unique, so it's always important to follow your healthcare team's advice. With prompt treatment, most people recover well from acute appendicitis. Let's quickly recap what we've learned about acute appendicitis. It is an inflammation of the appendix, a small organ attached to the large intestine. The pathology behind this is often a blockage in the appendix that leads to infection. Symptoms include abdominal pain, nausea, and fever. Diagnosis typically involves blood tests and imaging, while management can range from antibiotics to surgery. If surgery is required, the appendix is removed, and recovery usually takes a few weeks. Remember, acute appendicitis is a medical emergency that requires immediate attention. Stay informed and stay safe.